The Acting Permanent Secretary for Health and Medical Services, Ms. Susan Kiran, the Department of Foreign Affairs and Trades, Representative Dr. Francis Bingo, the Department of Foreign Affairs New Zealand, Representative Ms. Marissa Mosio, the Pro Vice Chancellor Research, Professor Mohini Singh, the Dean of the College of Medicine, Nursing and Health Sciences, Dr. William May, representatives of regional and international organizations, here representatives from the Jioji Institute of Global Health Australia, senior representatives of government and statutory organizations, our friends from the media, and distinguished guests, ladies and gentlemen. Isambul Naka Namaste. Assalamu alaikum, Naimori, and a very good morning to you all. It gives me great pleasure and certainly an honor to provide the opening remarks for the launch of the FoodSwitch Fiji App, which has been developed by the Jioji Institute of Global Health Australia in collaboration with the College of Medicine, Nursing and Health Sciences of the Fijian National University. And non-communicable diseases, NCDs, have reached epidemic proportions in Fiji and many of our Pacific neighbors. Diabetes, heart attack, stroke, hypertension, obesity are major problems in our communities, as you all know. Now, non-communicable diseases have risen mostly due to poor lifestyles, particular diets, physical inactivity, tobacco use, and overindulgence in alcohol. Now, I'm just stating facts here, and you all know all about them, in fact, more than I do. Now, non-communicable diseases contribute to a significant proportion of illness, disability, and premature deaths in Fiji. And for those of you who have read the Fiji Times, just the headlines, it's alarming. Comments by Dr. Konrote, the Honourable Minister. NCDs are a major social and economic burden to our nation and are robbing us of our productive workforce, community, and family members. Economically, I've been told, reliably informed, that this country spends about $400 million annually for the treatment of NCDs-related illnesses. A lot of money that could be diverted to other sectors. Now, this major problem requires a considered effort of all Fijians, as we've heard from the good doctor. The Ministry of Health cannot do this alone. It requires a multi-sectoral approach that involves all parts of government, civil society, the community, and the private sector. I strongly believe that we all know that eating well is important for our health and well-being, but knowing what to eat and how to choose healthier options is not always that easy. We're fortunate in Fiji to be exposed to having a wider choice of both local and imported foods extensively available for us to choose from. Now, the team at the Ministry of Health works in partnerships with other ministries and associated groups within the country that promote a healthy Fiji to ensure that teachings about healthy eating, which should start from the home, the schools, and continue through at all levels and sections of our communities, are ongoing. Now, however, from today, Fijians will have access to a new tool, an innovative tool to help them in choosing a healthier diet or a healthier option. Well done. About time. Now, value. The FoodSwitch app allows Fijians to look at items in stores and see whether or what healthy items are there to choose from. Now, Fijians can simply scan the barcodes of food and beverage products in any store and receive immediate, easy to understand nutrition information about the product, as well as a list of similar foods that are of healthier choices. Wow. We've made some progress here. Good progress. Not only for the sake of the nation, but for those of us today, but let's think about our children and our grandchildren who are going to be our leaders of tomorrow. Naka. Now, the FoodSwitch app is like having a nutritionist on hand at the supermarket. I like that. I like that. Sounds very nice. About time too. Good. At this juncture, I commend the Fijian National University and the Jioji Institute for Global Health Australia for developing the FoodSwitch project in Fiji. Thank you very much indeed. Congratulations. Naka. I've been advised that the Jioji Institute is committed to maintaining the app for the next 2 years until 2021. I think we need to educate our people about this app. More to come, Doc? Good. Now, ladies and gentlemen, this is an ideal and valid opportunity to discuss ongoing data collection, to establish a food monitoring system for Fiji that provides the government an ongoing database about the food supply to make well-informed and reliable policy actions. Now, an aside here, if I may, one of my hobbies is gardening, farming. I like to plant my own vegetables and my own root crops. Not only is it good for the body in terms of nutrition, but it's good exercise. And for information, my team and I, as the lead advocate for the fight against NCDs, we try and do our PT 5-7 kilometer walk around in the mornings, and then we spend another hour in the garden before we go to work. And we try to do the same in the afternoons when we have time. So may I offer an open invitation to the members of this forum. You're most welcome to join us early in the morning. We get up at 4 and we're on the road at 5. And on Fridays, Dr. Tukana knows all about it. We hump our packs. And being a former soldier, and I like walking up and down the hills. So if you see the mountains up there in the Namosi Highlands, there's a good road network that goes up and down. Sometimes it's a bit challenging for the body, but it's certainly good for the soul. Again, may I take this opportunity to thank all our partners and stakeholders, and in particular the Australian government, for your continuing support and assistance and the provision of the research grant through the Department or DFAT, an Innovation Exchange Program, with the New Zealand friends too as well. Last but not least, I wish to express my sincere appreciation and gratitude to the Dean, the Associate Dean Research, and the staff of the College of Medicine, Nursing and Health Sciences, and the Jioji Institute for Global Health Australia for taking on the challenge of developing the app and putting processes in place to ensure that all consumers choose healthier food and drink options in the supermarket at a glance in combating NCDs. I now have great pleasure in declaring the FoodSwitch Fiji App launched in 2019. Thank you, Vinavalevu, Fayak, Dhanyavad. May Almighty God continue to bless our beloved country and our friends from across the Pacific. Navalevu.
So His Excellency the President scanned the barcode, and that's the...
So thank you for our first scan of the Fiji Foodswitch app. So what we can see here is we've scanned the barcode of, I think it was a tinned pear slice, and the Foodswitch app has presented the information, and in this instance it's presented the information using the traffic light colour-coded labelling system, which many people will be familiar with. So this is the healthiest product on the market within this food category. So the first thing that we can see here is the nutrition information across the top. It tells us the nutrition information for every serving. So the information given with the energy, the salt, the saturated fat, and the sugar. And then it directs you, if there was a healthier alternative, it would direct you to a healthier alternative. But in this instance, this was the healthiest product in that category. Thank you.
Thank you, Anna.